Hello, my name is Jong-Moon Chae. I'm a professor of Wongang University in South Korea. Drs. Lee and Jung are former residents in my department. Dr. Park is professor and chair, postgraduate orthodontic program, Hyun School of Dentistry and Oral Health. Now, I'd like to introduce our case report. First eruption of impacted and transposed canine with a tap. Temporary skeletal anchorage device was very helpful for the treatment of this case without any harmful effect to the adjacent case. Then, I'm switching to Dr. Lee.
An 11-year-old girl came to our clinic with the chief complaint of delayed eruption of her maxillary left canine. The panoramic radiograph showed transposition of the impacted maxillary left canine with the maxillary left lateral incisor. A lateral cephalometric assessment showed a Class 1 hypodivergent skeletal pattern with normally inclined incisors. Considering these conditions, two treatment options were planned. The first option was to align the impacted canine in its current position without the resolution of the transposition. However, additional procedures would be needed, including periodontal surgery. The second alternative was to reposition the transposed canine in its original anatomic position. This option had some disadvantages as well, including a long treatment time and possible root resorption of the adjacent teeth during the traction of the canine. The patient and her parents did not want any of post-orthodontic restoration, so they selected the second treatment plan, understanding the risk of root resorption and accepting the long treatment time. After the periodontal assessment was conducted by referred periodontist, the alignment of upper dentition began using standard edgewise appliance. Soon after, the impacted canine was surgically exposed and a button was bonded. Using microimplant installed on the right posterior area, the canine was initially retracted posteriorly to prevent root interference. Meantime, the space for the canine was arranged and the canine was moved buccally into its ideal position. The total treatment took 53 months, including the completion of the torque control of the canine. The optimal positioning of affected teeth was achieved, and the facial balance was maintained. Maxillary canines are important keystones for the facial appearance, dental aesthetics, arch development, and functional occlusion. However, a disturbance in eruption of the maxillary canine is relatively common. Cone beam computed tomography is the best way to make an accurate assessment of the relative position of the affected teeth. These images would be also helpful in determining the feasibility of the surgical procedure, as well as the best direction of the orthodontic forces. In this case, to prevent potential root interference during reversion of the transposition, a microimplant was inserted in the palatal slope. The impacted canine was retracted into its ideal position without any adverse effect on the maxillary arch.
With the use of CBCD and microimplant, the aesthetic and functional results were obtained. I hope this case report will be beneficial for treatment of other similar cases. Thank you for your interest.